etiologically speaking, it seems that with, many of these conditions, ADHD, autism spectrum, that there's definitely a degree of neuroinflammation that seems to be taking place based on, but just kind of curious sort of thoughts on that.
I think it's an amazing area to do more research in of what actually is going on underneath the surface. From a more like behavioral approach, I think that some of the benefit that's happening in the ketamine therapy is that it's really like a sensory isolation. It's just helpful for busy minds and busy nervous systems to be able to just calm down. We know that in autism, even ADHD, neurodivergent systems overall, that people often have a hypersensitivity to stimuli like touch or sound or visual.
You're listening to the Applied Natural Medicine podcast, showing how the science of naturopathic, integrative, and functional medicine is applied by clinicians in real-world practice. This is a production of NDNR, publishers of the Journal of Applied Natural Medicine since 2005.
All right. Hello, everyone. I'd like to welcome everybody today to our NDNR Applied Naturopathic Medicine Roundtable discussion. I am Dr. Kareem Kandil, the current medical director of NDNR. And today's panelist is Dr. Conor Watters, who is going to be discussing ketamine-assisted psychotherapy, its history, clinical uses, and then giving us a case example. I wanted to give an introduction to Dr. Conor Watters of Healing Waters, LLC, located in Seattle, Washington. Graduated from Bastyr in 2022 with his doctorate in naturopathic medicine, earning his Master of Science in Ayurvedic Medicine in 2018 from Bastyr. And in between, he served in the Washington Army National Guard, running 911 calls as an EMT, working with the American medical response during the COVID-19 pandemic. He is passionate about working with service members, veterans, first responders, and outdoor enthusiasts. Dr. Conor Watters, welcome today.
Hi, Dr. Kandil and all of NDNR and the fellow listeners here. Good to be with you.
All right. Well, open up. So ketamine-assisted psychotherapy. As you talked about in your article, ketamine's a drug that has been around for quite a while. First developed in 1962 and first used in humans in 1964. If we look at the research on ketamine, there is no shortage. Over nearly 28,000 articles cumulatively on PubMed, with over 5,700 on depression, 5,500 on pain, nearly 1,500 on anxiety, and 500 articles looking at PTSD. And as you mentioned, ketamine is the only nationally legal medication suitable for psychedelic-assisted therapy in the United States and is a Schedule II controlled substance. Let's go ahead and go into a deep dive talking about ketamine, Dr. Watters.
All right, Dr. Kandil. Well, you're right. Ketamine is the only nationally legal medicine that can be used for what we call psychedelic-assisted therapy. And it was developed in the 1960s by the Parke-Davis Laboratory Corporation. It was originally developed as a replacement for phencyclidine, also known as PCP, which became banned for human use sometime in the 1960s or 1970s. Both of the drugs are from the dissociative class. In essence, they kind of temporarily inhibit parts of the brain from communicating with each other. And so that leads to compartmentalization that is also useful for anesthesia and for sedation. So really, they were developed for the surgical setting. The problem with phencyclidine was that people had a lot of very intense hallucination and kind of a delirious state that could include agitation when they were coming out of the medication-induced sedation after surgery. And so medical professionals found that that was unfavorable, and the pharmaceutical industry was looking for an alternative. So they found ketamine, which has less of that effect. There's still kind of a twilight zone kind of effect that happens when people are coming out of the surgery. In some cases, that's considered a side effect. Some of the sort of visual hallucinations and altered state. And in a surgical setting, over the history of its use, that was often paired with a benzodiazepine like midazolam to help to control that side effect. Interestingly, though, from a different lens, from the psychotherapeutic lens, the content of those sort of hallucinatory experiences could be considered material from the subconscious mind that could be useful for examination. So with the right context and preparation, what might be a overly intense and uncomfortable experience for the patient could be turned into something that could be workable and be a source of greater exploration that would lead to comfort and better adjustment in their life. So that's a topic we'll get into more, I think, later on in our talk today. Really a remarkable substance, lots of uses. And like I said in my article there, the surgical ward, really the development during the Vietnam War, partly in field hospitals. And then later on in military and paramedic medicine, it was really found that it could be used in the field. So it's commonly on paramedic ambulances now, including domestically, all over the United States. And it's an international standard rescue medicine for people who are needing sedation and who are also needing safe pain control in a manner where an opioid is more dangerous because of the risk of breathing suppression. So really kind of an amazing drug. And it definitely has a role in the naturopathic practice in a bit of a more complicated state because of its controlled status. And I can elaborate on that further as well.
Yeah, absolutely. And I think, you definitely showcased a lot of the wide therapeutic use of ketamine. It's very fascinating because of its, safety and efficacy profile. We see it being used in various fields of medicine. I mean, it's one of the go-to when it comes to sedation for pediatrics because of its safety profile without that risk of, again, airway collapse, even though it does offer some of that pain modulation through that new opioid receptor activity that you mentioned in your article. And so much so it's even, a standard in use in veterinary medicine as well. So it's fascinating that it has this very broad use. And then at the same time, there is also what can be considered the illicit street use of ketamine, which is something, I'd like to kind of get some of your thoughts on a little bit later. But again, I think it's very important to kind of note that safety tolerability profile versus drugs like you mentioned before, phencyclidine, PCP, which from my experience in the ER, I've got my own share of stories of, patient agitation and severe psychosis from PCP, but I don't really have any recollection of any sort of similar scenarios of somebody coming off the street having such an acute psychotic episode from ketamine. Definitely something to kind of keep in context that, when we talk about these terms about dissociative psychedelics, that there are definitely very significant qualitative differences from one drug to another, and we can't just like paint them all with the same brush. And it's important to kind of know the importance in terms of dosing methodology and the differences we're going to see with the use of these drugs. So you talked a lot about kind of its use in civilian medicine, a little bit in kind of military medicine. I know that's something that's kind of near and dear to you with your work and concern around veterans. Let's just kind of segue from the traditional uses of ketamine therapy comes to its use for sedation, for pain control, and talk a little bit more about the use ketamine when it comes to, assisted psychotherapy, its use in PTSD, depression. What seemed to kind of trigger that research to begin with? Because a lot of our theories and even our clinical use of drugs when it comes to the field of psychiatry often kind of came about as sort of like incidental findings we find with a drug having a certain side effect, whether it's like reserpine or isoniazid, and that kind of developed, if you would, whole field of psychiatry based on a monoamine hypothesis. But again, ketamine works a little bit differently. So tell me a little bit about how we understand how ketamine works and what, I guess, began its use for support in psychedelic-assisted psychotherapy.
Okay. Well, that's a great question, Dr. Kandil. The origins of ketamine-assisted psychotherapy, it's since live on the recording here, I'll talk freely, are actually an area that I might need to investigate even further. It's a little bit hard to track down. I do know about some of the just in the 1960s and the 1970s, there were some very kind of open-minded and avant-garde, physicians and psychotherapists who were part of that culture of the better living from chemistry that came from the 1950s, but then the experimental modality of the 1960s and a little bit of the 1970s. And there was a lot of searching for how to apply these chemical tools to have a handle on the mind or to explore the mind, looking for deeper human experiences, kind of an overlap with humanistic psychology going on as well there, just a confluence of a lot happening. Basically, there was some experimentation with ketamine in Mexico. That doctor was using ketamine as a way to help patients come out of an intense psilocybin experience. He found that it really helped to gentle the landing that people would have by going from the intense classical psychedelic state of psilocybin, which is marked by both expansiveness, but also a very intense somatic experience, into the dissociated experience, which is much less somatic, and it's more more expansive, more kind of soft emotionally. And also ketamine has an ability to be an anxiolytic, to just help to cut anxiety as well. Unfortunately, the problem with that approach was that psychotherapist was using some very unconventional means and was really treating some of the psilocybin work like an exposure therapy, with both like negative and positive stimuli playing on video, on projector in the room. And it was an example of just how people really need to be careful with their approach to protect against harming the patient. So there were some complaints against that provider. There was another provider, or rather explorer, John C. Lilly, who developed the flotation tanks. He worked for the federal government, working with research on whales and acoustics. It's really a very eccentric person from the 1960s. He did some interesting work also on exploring ketamine as like an exploratory agent, combining it with flotation tanks. Both of those characters are very eccentric persons, and of course, these very eccentric sort of rock stars of the 1960s and 70s got very publicized. The actual origins of ketamine-assisted psychotherapy, I believe, are a lot more quiet, and I could actually do more research into that. That's kind of a hard question for me to answer. But what I know is that field really developed slowly through the 80s, the 90s, the 2000s, and the 2010s, and the 2020s. And it's really boomed in about the last 10 years. During the COVID pandemic, of course, there was the boom in the mail order ketamine-assisted therapy using lozenges. Mind Bloom was the biggest organization. They were out of New York, and they were mailing lozenges after a telemedicine consult. And I think the idea there was that the laws for controlled substances had changed during COVID because of the emergency. And so that sort of prescription was able to happen. And also the idea was that people were having a harder time seeking treatment for depression and anxiety. And there were increases of those diagnoses during that time with the emergency. And so there was a boom cycle there, but then there was a categorical bust cycle, because it seems like there was overprescribing, there was a lack of scrutiny, there was a lack of close supervision that was going on there. So just like the dose determines the cure or the harm with the medication, like the amount of supervision, I think, can also determine similarly. So since then, the industry has started to regulate itself more. There have been more of a development of like ethics groups. I'm blanking on the name of that group there. I think it's like
Well, there's the MAPS group, which I'm aware of, the Multidisciplinary Association on Psychedelic Studies, which I know they play a role on a lot of the research that's taking place with, psychedelic assisted therapy, whether it's psilocybin, MDMA, ketamine, etc.
Yeah, well, there's MAPS who are originated to preserve the potential for MDMA to be used as a therapeutic agent. Doctor, I think he's become a doctor now, like a doctor of Rick Doblin. Rick Doblin founded the Multidisciplinary Association of Psychedelic Studies, the 1980s. He was involved in the psychedelic movement for quite some time before that as a young man. And when it became apparent that MDMA was going to be outlawed because the federal government found problem with its great use in the underground club scene, and there were some issues that were happening as well. Definitely a lack of supervision and a lack of kind of medical control, perhaps. Um, the whole situation got soured, a situation where MDMA was being used in psychotherapeutic office settings and was really being used as a couples therapy aid, and really to great success. That was a really good model for the work that ketamine can do for individual treatment, it seemed like. So MAPS is great. MAPS is also definitely taking ketamine therapy under its wing. Is just saying that there are professional groups specifically for ketamine-assisted psychotherapists that are really about supervision and really about careful scrutiny of ethics in the relationship between a therapy provider and the patient, where altered states work is included. And I think that's really a maturing of the psychedelic assisted therapy movement, a real cautionary approach to having altered states be part of the treatment room. A lot of that work has to involve being aware of one's presence as a provider, being aware of the greater sensitivity that the patients are having when they're in that altered state where everything is magnified. And I think it's great. And it was a very big component of the training that I received from the Integrative Psychiatry Institute. We had great guests to educate us on that. So I think the history of ketamine assisted psychotherapy is a really complex one, and I think the future is a good one.
Excellent. So talking a little bit about, the past. So I know you talked about in your article how in Russia they started documenting the use of ketamine-assisted heroin addiction treatment. And it's interesting that you mentioned the use of ketamine in helping people who were getting psilocybin therapy, sort of in helping them with kind of the coming down aspect, that very kind of intense somatic as well as mental experience. And so I kind of wanted to use the opportunity to talk a little bit, at least, about some of our theoretical understanding around the pathophysiology of depression, PTSD, and how these drugs may potentially work. Now, of course, what has been the prevailing theory in the field of psychiatry has been this monoamine hypothesis, serotonin or a lack thereof as being a driver of depression. And the more studies we've conducted, the more we've looked at different substances that have potential in supporting depression treatment, that we find that those simplified assumptions don't seem to hold as much water, so to speak, when it comes to how these things may actually be of benefit to certain patients. And no doubt, there are definitely many groups of patients for whom there are, black box warnings when it comes to the use of conventional antidepressants. And again, part of the issue is that long-term sort of cumulative dependency that comes with some of these medications. Whereas when it comes to the use of psychedelic assisted therapy for psychiatric issues, it seems that you have the benefit of being able to use these substances only a number of times and being able to potentially, gain that therapeutic benefit from it. So I want to kind of talk a little bit about, the main understanding of how ketamine works through its NMDA receptor antagonism, and just kind of hear you sort of talk to that and how that can be playing a role with some of these, psychiatric pathologies that we're seeing.
Okay, that's right. Well, so the NMDA receptor system is involved very broadly in the central nervous system. It seems like what happens when ketamine interacts with it is that the glutamate system, which is very much related to the NMDA system, is suppressed temporarily, and then correspondingly, chemistry is increased and brain-derived neurotrophic factor is released, which is responsible for promotion of neurogenesis, really more pairings of axons with dendrites, more branching of the dendrites happening. There's some amazing footage of this happening under microscopy, and it's quite beautiful. And so there's this idea that greater neural networks are being formed, and that the actual use of psychotherapy to get people to talk and to get people to feel is actually firing up more networks. So when there's this chemical component and this behavioral therapy happening at the same time, including over the course of effect of about a week, that the neuroplasticity is increased by the ketamine, that's kind of this great moment where growth and change can happen. And it's thought that that neural patterning can really start to get shifted and then kind of set. And then continued care, of course, would be a great way to continue to move those improvements forward. And that's really part of the model of ketamine-assisted psychotherapy, including, as I learned it, typically about 3 treatments to really see what kind of effects we're going to get, and potential follow-up treatment as well.
Excellent points, Dr. Watters. And when we think about some of the NMDA receptor antagonism, glutamate receptor, glutamate, major excitatory neurotransmitter of the central nervous system, is of course very important and is balanced by the activity of GABA and the CNS and glycine in our peripheral nervous system. The problem oftentimes will be if we have an imbalance, and if we have too much, neuro excitatory activity from glutamate, this can actually lead to neurotoxicity, apoptosis of neurons. And here we're finding that we're improving synaptic plasticity, improving neurogenesis through the increase in BDNF. And sort of coming back to a point you were talking about, both, of course, in terms of the set and setting, which I think we'll talk about that sort of leading into your clinical case. But in our potential understanding of these various networks within the brain and how these various psychedelics can assist with that. Our understanding, for example, around psilocybin in its way that it disrupts that default mode network, that sort of loop that we tend to sort of develop in how our brain patterning tends to fire. And by potentially disrupting it, that gives us an opportunity, obviously working along with the subconscious and the actual psychotherapy component of it to help with kind of that rewiring of those mental pathways that oftentimes may get kind of stuck in this sort of feedback loop in these patients that are dealing with depression, anxiety, PTSD, etc.
Absolutely, that's what we're talking about here with changing this chemistry. We are temporarily interrupting the default mode network here in this work with ketamine-assisted psychotherapy. It's definitely a little bit different than the way that classical psychedelic like psilocybin works on the serotonergic system. But it's still making similar effects that are helpful. I think part of the thing with these substances as well is that they have some anti-inflammatory effects that help with neuroinflammation, which is such a crucial part of mental health. Pathology like organic depression, for example, has an inflammatory component often in the brain. So these medicines also kind of help to quench that fire.
Excellent. So before we kind of get into your clinical case, tell me a little bit about the actual psychotherapy component. We're dealing with patients that have deeply rooted traumas, this kind of, depressive sort of mentality that's been reinforced. How are we using, I guess, both what are the patient's typical sort of experiences, as they're going through that ketamine assisted therapy, and how are we leveraging that from a psychotherapy perspective to help them address some of these kind of subconscious blocks they may be dealing with?
Right. Well, we're having them come in, and once they go through the medical evaluation to make sure that the medicine is safe for them, and a psychological evaluation to make sure that they're mentally prepared to do ketamine in a safe way, and in a way that we could reasonably expect that they would get benefit. We start to build rapport with them, and we do start to do therapy with them. Really, it's about learning what their needs are, where they're coming from, what they're working on. And then I like to always include, what would that look like when you are doing better? How would you know you're doing better? That's very important in mental health care. And for the patient that I treated in this case study, what they were really looking for was to be more socially at ease, to be more authentically themselves, to unmask, as they referred to it, in particular from their adult autism. They experienced tremendous social difficulty from being neurodivergent, also with an ADHD diagnosis. And they just found it stressful just trying to regulate themselves in a way where they were constantly feeling like on eggshells socially, and they were also feeling like they just weren't sure what to say or what to share with other people, and it became burdensome. As well, also the patient identified as genderqueer, which had been a change in their life, and so that was new and also a source of just I think extra use of mental resources, of just what they wanted to share with people, and just finding their identity, really. So maybe another way of describing what they were looking for was just better self-identity and self-expression. So, would you like me to continue with describing the case?
Yeah, go ahead, please.
So how that work happened with this individual was that in doing the intake, we found out that they had quite a lot of history of abuse, of being the recipient of abuse during childhood. It was quite a lot of an ordeal that they went through, and also some history of self-harm as an adult. And so we really wanted to take time to make sure to build a really safe therapeutic container so that if the really, really big stuff, the big trauma content came up, which we would expect it would, that we would really be able to hold that for the patient. So we did a total of 8 therapy sessions before we got into the ketamine-assisted therapy work. When we got into the ketamine-assisted therapy work, very quickly, I could tell that the patient was having some difficulty. They were seeming uncomfortable. As we had communicated, I used their intention to help center them during their therapy session. We usually develop a short phrase like finding safety for their intention for coming into their work. So I used that phrase for them, and as we had already agreed ahead of time, there's minimal therapeutic touch as well. Agreed ahead of time for consent to hold their hand. So they gave the signal, which was just raising their hand. I came over, placed my hand in their hand, and I just reminded them of their intention, say, finding safety. A couple minutes passed by, and they were doing much better. They were able to redirect into their journey. So when they come back from a journey, what we do with the patient is we review, what did you see? What did you hear? Did you encounter anybody? Were there textures? Were there colors? Did the soundtrack play a role in your experience? Were there any emotions, any feelings that were significant? Were you feeling like you were the driver of the experience, or like the experience was driving you? And were there any big takeaways? Then we'll follow up with them at a subsequent day over the course of the next week. And we'll explore with them, where do we go forward from here? How do you want to apply these insights into your life? And then we'll support them in that. So it's really a humanistic psychotherapy approach, really about empowering the individual with their journey of self-discovery. I also like to use some of the acceptance and commitment therapy modalities, such as diffusion, also self as center, and also a lot of values work, just to really understand what is important to this patient, to help them explore what is important to them, So that they're really empowered to walk away from our treatment sessions, being able to really be helpful for them. Especially true in the work that I do, where I will do counseling with people, but in my role, people may also go and work with a psychotherapist for their regular therapy as well. 9%. And then sublingual is, we'll call it tertiary, that has about a 33% absorption rate. So, of course, the onset is much faster with IV. IM takes about 3 to 5 minutes to take effect. And then sublingual takes about 15 to 30 minutes to take effect. So the treatment session needs to be longer, usually for sublingual. The duration of effect for ketamine is often about 60 to 90 minutes at the dosing that is provided. Doses typically were about at 1.6 milligrams per kilogram. I often saw doses come out somewhere between the range of 130 to 160 milligrams total, if my math is correct there. And everybody has a slightly different metabolism for drugs. I saw some people whose experiences lasted only 30 minutes. They were very fast metabolizers. And I saw other people whose experiences continued into about the 120-minute mark. A lot of people don't get nausea, but some people do get nausea. So we provide ondansetron for emesis and nausea control. Also, some people would benefit from meclizine as another kind of similar to nausea, like a motion sickness experience medication. I also found that scopolamine was a useful intervention as well for nausea and emesis that wasn't improved by ondansetron sufficiently. Usually a scopolamine patch would be helpful. And that would be identified typically after the first ketamine session. So I saw cases where that was really, really helpful, and the people were able to continue with the ketamine work because of the scopolamine patch. Interestingly, also, there would be ways to layer the ketamine that I witnessed, where, say, somebody is a fast metabolizer of the ketamine, then they would say we would do the following. They would have the intramuscular injection of the ketamine, but then we would kind of figure out after multiple sessions about where the ketamine would start to taper off in effect. And then we would supplement them with a secondary lozenge of ketamine to help tail that. Usually that would be something like they would get the ketamine injection, and then they would have a ketamine lozenge shortly after. But more likely than that, I think, because of it would be safer, I would recommend having the ketamine lozenge first so that it absorbs, so that the airway is then clear, and then the intramuscular injection could be provided, and then they're good to go. Or another approach could be that they would have part of the ketamine lozenge first, let it take effect, and then do a repeated dose of a sensible amount, maybe 15 minutes later, while they're still quite lucid and not in a fully altered state. That way, the overall pharmacokinetic curve would be better and the duration would be longer. And setting, of course, being the location that you're in, the safety of the environment you're in, and also the energies, like who else is around, other people, animals, and just sort of, it starts to get into kind of energetics, of course. And I've seen some really beautiful energetic considerations with some of the indigenous approaches to working with medicines, especially plant medicines, of course. Really, the tradition that I've dived into is ayahuasca in the Shipibo lineage from Peru, and it's just beautiful. they are masters of providing set and setting, of really working with somebody to really get them focused on their intentions and to really hear what their intentions are, because then they'll work with that intention with the person through medicine songs, which is beautiful. We do our best to kind of imitate that a little bit, curating like an audio playlist in the ketamine sessions. But these people are masters of actually producing sound therapy in real time. The setting is also beautiful. Naturalistic settings are absolutely wonderful for medicine work. If it's in the jungle, you have insects, birds, monkeys, bullfrogs making a beautiful chorus. Some of the work with the ketamine, some of the soundtracks would also include natural elements like flowing water that would be very helpful for there's so much synergy. It's this whole topic of ecotherapy, and just spending a couple of hours in nature can be so helpful for us and actually produce physiological benefits. Maybe even a couple of hours paired with ketamine, maybe even a couple of hours paired with psychedelic assisted medicine, even in the clinical setting of ketamine, just through audio therapy of natural sounds could provide those physiological benefits. That's a topic I'm curious about researching.
No, that's definitely a phenomenal insight. And, I think you touched on, I think probably one of the core aspects, the energetics is very real in terms of the impact, in terms of the setting. And, with a lot of the anecdotes, again, for people who've used, psilocybin therapy, many often find that they've done best when they're in nature, in an environment they know, not hiking into the middle of some random woods for the first time and doing a macro dose or anything like that. But that nurturing aspect of nature versus, again, what might be an intense type of club scene where, again, things can be a little too stimulating. The music choice may be the wrong type of music to be around for a healing experience. And I guess, something I wanted to bring up when you were talking about your patient who, again, is dealing with adult autism, ADHD, having, issues with that sense of self and unmasking. And I guess, be curious to kind of hear your thoughts and theories about talking about some of the neuroprotective, anti-inflammatory effects of ketamine playing an important role in helping these patients get back, into themselves and have comfort in themselves when, at least etiologically speaking, it seems that with, many of these conditions, ADHD, autism spectrum, that there's definitely a degree of neuroinflammation that seems to be taking place based on, at least, some of the different labs we look at, IL-6 amongst others. But just kind of curious sort of thoughts on that.
I'll admit that I could be a bit more well-versed in the actual chemistry of these things. I think it's an amazing area to do more research in of what actually is going on underneath the surface. From a more like behavioral approach, I think that some of the benefit that's happening in the ketamine therapy is that it's really like a sensory isolation. And it's just helpful for busy minds and busy nervous systems to be able to just calm down. We know that in autism, even ADHD, neurodivergent systems overall, that people often have a hypersensitivity to stimuli like touch or sound or visual, and that just going inward, going into the blackness behind the eyes with a really great light blocking mask. And then also going inwards with just really good headphones, really nice curated, appropriate playlist, non-vocal, because vocals can be very distracting, but just musical or natural can be very helpful. And also just being comfortable in a really nice chair with like a nice heavy blanket on, like a weighted blanket, maybe even, just really makes somebody feel good. The lighting matters, as they're getting into the chair and preparing to go into the isolation, and also as they're coming out. So maybe like a salt lamp is a good a modality. I also like to clean the room with Palo Santo. It's a sacred smoke from a tree from the Amazon.
Beautiful smell to that.
And I like to say a little centering prayer for myself and just get the energy right. So It's about having just a drop into just stillness and just peacefulness that I find is very similar to some of the approaches of deep meditation, like the concept of dhyana in Eastern meditation, where your senses are just purely absorbed into a higher state. I think that really is an antidote for the busy minds. And I think that especially people with neurodivergence really have a hard time with that in our very busy world. So from a behavioral approach, that's what I see. I would love to learn how to describe that more chemically.
Uh, I've been digging a lot into, kind of neuroscience. And the fact is, the more we dig in, the more I feel like it's almost an exercise in futility in certain regards. I mean, we talk about the serotonergic system and the various subtypes of these 5-HT receptors, depending on which structure they are in the brain, and that level of activation can result in completely different level of effects. And then you have, your own individual kind of, nuances, that bio individuality that can definitely impact the degree to which people respond. And so, of course, I think, like anything, using a sort of an empirical general approach, looking at the patient, looking at, where their traditional sensitivities or reactions to various other drugs may lie, and using that as a guide to how we're going to taper our approach to them individually. One thing I just wanted to kind of ask about with the patient case you work with, and maybe other patient cases you could speak to, is on treatment resistant depression and whether or not these patients were also on other, antidepressant therapy. Did they find that it's, wasn't working? Did they find that getting on ketamine and having these, psychedelic assisted psychotherapy sessions, was that able to get some of these patients off of long-term antidepressant use? I'm just kind of, curious on your thoughts of that, because we see, I think the current statistics are like 1 in 4 Americans are on a regular psychotropic medication. It may have gone higher or lower since the last time I checked, but from that naturopathic approach to harm reduction, and obviously we're talking about level 6 on the therapeutic order of synthetic drug, but if this is something that plays an important role in helping to repair psychological aspects of the self that are harmed and or damaged, and at the same time, if we can get patients off of some of these medications that they may be taking long term for life, sometimes stacking one on top of the other and developing physical side effects, especially concerns of, erectile dysfunction that can come with, or weight gain that may come with the use of various antidepressants. So just kind of wanted to hear your thoughts on that type of treatment resistant depression, and whether or not you've been able to find that patients have been able to get off of some of their medications after experience with ketamine assisted therapy.
So, so I have found that for the most part, I've either gotten patients in two categories: patients who are already on a psychotherapeutic agent, like an antidepressant to help them, say, treat the depression. That would be the reason why they're coming in usually if they're taking that medication. Or patients who have tried an antidepressant or just not interested in antidepressants. What I've actually found in my own, what I've actually found so far in my clinical experience is that people tend to stay in that category because they find that that approach is really working for them. So I have found that ketamine helps them to do better at what they're already doing typically. This patient, in this case here, they were already on an antidepressant, and they stayed on the antidepressant. They found it was stabilizing and really helpful. In fact, they even knew antidepressants that weren't helpful for them, but they found the right one, and this ketamine helped it to work better. As well, for another patient of mine, she had been on an antidepressant for quite a lot of time, had tried a few, found the one that worked really well for her. She was having some difficulty adjusting to her role as a grandmother. And so she tried ketamine assisted psychotherapy. It helped her over the course of several months. We did 3 sessions. And then she went on vacation with her husband on a cruise to the Baltic as well, I believe, as to Iceland. Just a beautiful scenic cruise. and she came back and then she did another ketamine assisted psychotherapy experience. She found that she was doing phenomenally. So it seemed like the extra stimuli of travel just really helped her to get that inspiration. And then her whole system was lit up when the ketamine was introduced, and she had a lot of content there where she found hope, basically. And I think hope is ultimately the best medicine that we want to get at. So, you know, I'm sure there are cases out there where people are benefiting from ketamine assisted psychotherapy and getting off of medications. I'll stay tuned looking for it. And I think you asked me earlier about the heroin addiction treatment it was in Soviet Russia. It was interesting. From what I read about it, these were actually state mandated ketamine experiences,
Hmm.
which I thought must have been kind of horrible, kind of, kind of or Orwellian or oh God,
Informed consent was
yeah,
probably not the priority.
seems a little bit closer to a Clockwork Orange than to an informed consent environment. So it seemed like some of the results were good there, but I would definitely advise against, big government getting involved in actually applying psychotherapeutic agents to people. I just, power is a dangerous thing. And so we as individual physicians have to be careful with how we wield power. And, we got to develop trust. So, yeah, I think we can learn from the Russian trials on ketamine for heroin addiction, but we would want to do things differently here for sure.
Absolutely. I think your key point of hope, and I think that's something that I think is what really makes naturopathic medicine and just our approach to patient care so important. You know, again, different patients are going to respond to different treatments and therapies because of that bio individuality. I think it's important to definitely access to as many modalities as possible, especially ones that are showing promise, like ketamine and other psychedelic assisted psychotherapy. I mean, you hammered a lot of phenomenal points from the long use of this drug in emergency settings and OR settings. It's safety of use, the very reasonable duration of the use of this drug and the different methods of administering it. And of course, I think harping on the importance of preparing the patients for this therapy with that appropriate psychotherapy both beforehand, during, afterwards, the importance of creating that safe, nurturing set and setting for the patient, especially if you can augment it with nature sounds and nature environment, and again offering patients that sense of safety going through it. I think that there's a lot of potential when it comes to the future research, again, from treatment resistant depression to PTSD, anxiety. I think we'll continue to see this research expanding over time. I guess just kind of want to give you an opportunity to offer any sort of closing statements and insights, recommendations to naturopathic doctors that want to start diving into this.
I think that what we know so far about ketamine is that it's a very phenomenal medication that can be used in a diverse amount of ways. And I think that that really speaks to it reaching a really pivotal number of systems in the human. And it really speaks to the resilience and the adaptability of the human nervous system, and the amazing ways that we can push our chemistry and our biology and just our fiber. So I think it's just an exciting, it really reveals that we're starting to actually get reach into the difficult parts of the human experience. And we're really able to start to work on some massive change for cases that we previously would have just written off. So I think stay hopeful, keep looking for breakthrough therapies. They are definitely out there. Um, you know, don't write off a patient, see what they're willing to do, see how their biology is willing to change. Let them speak for themselves, really. And if you want training in psychedelic assisted therapy, there are a variety of good institutions out there, like the Integrative Psychiatry Institute or the Prati Group. You can also look into the Multidisciplinary Association of Psychedelic Sciences to see what groups they endorse as well. I'm also, of course, available at my website, www.healingwaters.com. I'm happy to answer any questions. I'm also happy to provide mentorship for naturopathic students or other naturopathic doctors. It's an exciting time out there, so I'm happy to continue this discussion. It's just wonderful.
Absolutely. Again, I want to, from the bottom of my heart, thank you again, Dr. Watters, for the excellent content you provided in the NDNR article and for this phenomenal interview experience today. You had so much clinical, insight and wisdom to offer. Again, to anyone who's watching, you can reach Dr. Watters at healingwaters, WATTERS.com. And again, just want to remind everyone that these recordings will be available for those who are enlisted in NDNR's CE, continuing education. And we'll be generating content from this in order for people to get continuing education credits. Again, want to thank you again, Dr. Watters, and I'm Dr. Karika Deal from NDNR, and hope you all have a blessed rest of your day. Thank you.
This has been the Applied Natural Medicine Podcast, a production of NDNR, publishers of the Journal of Applied Natural Medicine since 2005. Access the full archive of case reports and clinical insights at ndnr.com. For subscriptions, partnerships, or submissions, contact us at editor@ndnr.com.